they've seen like a lot of botched jobs, they get nervous about that, or is everyone gonna have duck lips? And like, no, that's either a very specific detail that they want, or that's someone that didn't do a good job.
In this Backstage Pass series, we have authentic conversations about the evolving role that aesthetic procedures play in your life. We also dive into the often overlooked steps that you should understand before making the leap to your renewed self. These are the conversations that you want to hear, but just don't have access to until now.
I had this client the other day on my table, and we were just talking about things you can do for her skin, and she was curious about filler. And she said she'd been to other med spas and had some consultations before, and she felt like people that work there looked a little overdone, and clients that she had seen that go there looked a little overdone. She wanted to know, is there a way to do filler without looking, fake and overdone? And I said, yeah, I really think that one of the things we pride ourselves in here, we never want you to walk out the door looking like you've had work done. Whether it's, with our makeup or our skincare or lasers or plastic surgery, especially filler too. And so I didn't know the specifics on how to tell her how we make it look natural, but what would you suggest?
So yeah, I totally agree that I think that the best way is basically that natural look. And I think that some people actually don't realize where they need filler almost, because they're like, oh, I need it in my nasolabial folds or something. When really, I could just pull up their cheek, and instead of making them look so overdone, especially with that mouth area, you know what I mean? Like you can totally get that. What is the other word for it? It's almost like, kind of like
more of like a conservative.
Yeah, but it's almost like you get that blowfish type of mouth, you know what I mean? When it's too puffed out.
For sure.
Yeah, you get too puffed out. But that's what it is. That's the face that they don't want to get. It's the blowfish look.
So do you, when it comes to Botox, I know that you don't numb, but when you do filler, do you guys use a lot of numbing agents, or how can I comfort my patients when they're in my room, expressing their concerns with injections? How can I calm their nerves before I send them over to you guys?
Well, yeah, before I do anything, I make sure that they are topically numb. So basically I have medication that has lidocaine, benzocaine, and a couple of different numbing agents just to make sure that they really don't feel as much, right? And then I don't use any numbing blocks because I find that those are even more painful. So why am I going to inject you with a numbing block when I can just give you a topical numbing medication, which is going to make you feel comfortable throughout the procedure anyway? Do you remember when I did your lips, we had almost like a vibrating device that kind of just distracts the nerves? So I use that a lot too, especially with Botox itself, because people will flinch when I kind of put that needle a little bit closer to them, and it makes them definitely feel more comfortable.
I did not believe in that at all until she did my last, injectable treatment.
Right.
For my wrinkles, and I thought, this is crazy, this doesn't work, but she used it and it was...
I agree. From my personal experience, it just takes your mind off of what's actually happening, and you're thinking about that vibration.
It's a distraction.
It totally, yeah.
Interesting. I think that's the misconception a lot of times. It scares people away from injectables in general, is that anticipation of there's a needle in my face, I'm super scared, or they've seen a lot of botched jobs and they get nervous about that, or is everyone gonna have duck lips? And no, that's either a very specific detail that they want, or that's someone that didn't do a good job.
Right.
It's never, I feel like when you go to the right place, people really never notice what you've had done, they just notice that you look better.
Right.